Staying a step ahead is important for good dental health. Did you know that 37,000 people are diagnosed with oral cancer? Also, 43% of them will not survive more than 5 years. And to tell me more about it, I'm joined by Abilene Dental's Tiffany McAdams. Those are some alarming statistics.
They are alarming, and what's even more alarming is that most of the oral cancer that is diagnosed is in stages 4 and 5, because it's diagnosed by people who are actually looking inside their mouth and the lesion is already on top of the skin.
So they missed the early detection, is
Right.
that what you're saying?
Exactly. Well, we didn't have good forms of detection before, but now we do, and it's called the VELscope, which stands for, I'm going to read this, Visually Enhanced Lesion Scope. And what it is it just shines a light inside your mouth. It takes about 2 minutes. We'll do it once a year, and it can detect lesions way before we could see them with the naked eye.
And so do you guys treat a lot of this at Abilene Dental?
The oral cancer or the VELscope?
Well, both, really.
We've had people that have definitely had oral cancer that have been in our office. We've been lucky that that number's been really few. But this will be able to let us detect it so much sooner that those people could be helped right away.
Wow, I just want to see how, well, I guess
Yeah.
we'll open this up right here, and it's really a tiny little object.
Yeah, it is. It's just basically, it looks and feels just like a light that's being shined inside.
And it's an easy process.
It's super easy. Like I said, it takes about 2 minutes, and the hygienist or the doctor will look through it while the room is darkened, and it's a blue light. Yeah, I'm not going to do it here, but they'll just shine it through, and they can actually attach a camera to it as well, and they can send that to the oral surgeon, who would be the next step after if we detected oral cancer.
All right, what do you want to say for people who are nervous about the potential of having oral cancer?
Well, the first thing is to know, your risk factors. You don't, anyone who, of course, is a tobacco user, whether it's a smoker or chewing tobacco, is at risk.
Right.
Then excessive alcohol use. But the biggest thing is alcohol use with tobacco products. So if you're doing both of those things together, your risk levels are really, really high. And you definitely want to get checked out. But here's the thing, too, is that only 11%, oh, excuse me, I apologize. 25% of the people that have had oral cancer diagnosed last year, they didn't have any risk factors.
Oh, wow.
So while those risk factors are important, everybody needs to get screened. We just need to think of this like any type of regular cancer exam, whether it's like a pap smear or a mammogram or a colonoscopy. These are all things that people do regularly, but we've just never had the technology before to do it, and this is so much easier than all of those too.
Well, it sounds like if you're shining a light and just clicking and smiling, really. You mentioned some, I guess, advice. Also, early detection can really mean a lot, and other things. Is there any other advice that you want to just out there, information? Really get checked up if it's just like any other.
It's really just 2 minutes can save your life, and why not do that? Why not come in and have that done once a year and just have that peace of mind?
So try to make that appointment.
Yeah, exactly.
2 minutes can save your life. That's actually a good quote right there. Thank you so much for being here, Tiffany, and tell hi to Dr. Christy Luby for me. All right, you can make your appointment at Abilene Dental today. Just call the number on your screen or head into their offices of Buffalo Gap Road. Also check them out on Facebook and Twitter. Just search Abilene Dental.